Hello everyone, and thank you for joining this second webinar to provide an update on the COVID-19 outbreak related to the Duchenne and Becker muscular dystrophy community. My name is Suzanne, and I'm the Communications Coordinator of the World Duchenne Organization, and I'm here yet again with Elizabeth, who's the Chair of the WDO. And in this webinar, we invited two other clinicians or experts who will address the questions that arise from the community in regards with this coronavirus outbreak. So this webinar is a follow-up webinar on the last given one on March 14th. And to access this previous one, you can always check the live feed that we have, and there we also have the report of this webinar. So you can head over to worldduchenne.org to get more information about that. But before we start, I'm inviting you to join the discussion in the comment section, because you know you will be automatically muted upon joining. Your keyboard is your voice. So would you like to ask a question? You can do this via the chat option. So when you click in the top right corner on the speak icon or bubble on in the middle bottom if you're on mobile. So at the end of the webinar, we will collect all the questions that haven't been answered as well, so we can try that to provide input on a follow-up webinar. So this webinar will be recorded. You will receive a link to the webinar recording and a report in English that you can translate and disseminate with other clinicians and families as well. So this is the agenda for today. We start with a brief introduction where I will discuss the outcomes from the previous webinar, and then we will head over to the questions from experts. And the experts this time are Dr. Jarod Wong and Professor Annamaria de Luca, and they have provided their considerations on the questions that we collected this time. Then Nicoletta will explain something about the Show Your Solidarity campaign, before we call it a wrap-up and move on. So last webinar, we had Professor Mercuri, Professor Montoni, Professor Finder, and Professor Goemans share their opinions and questions we gathered from the community. And you can find this recording together with the report on our website. And to summarize these findings, we created a list of 15 things we know so far about COVID-19 in relation to the Duchenne and Becker muscular dystrophy. So far, there are no confirmed cases of the coronavirus in people affected by DMD or BMD, nor they have a higher chance of catching the virus, even if you're on non-invasive ventilation or using a cough machine. So just like anyone, families with Duchenne and Becker are urged to stay at home as much as possible to avoid possible contact with the virus. So any hospital visits that are not urgent can be done through the telephone or should be postponed. And if your country does not have closed their schools yet, we strongly recommend to keep your children, especially when they're on steroids or who have who are respiratory compromised, to keep them at home. So further on, doctors recommend to not make any changes in your medication regimens unless your clinician advises you so. And in terms of medication, it's also advised to order a short supply of your medicines in case of a shortage. Further on, if somebody with Duchenne or Becker catches the virus, they will have a bigger chance that it will cause a viral pneumonia. And this will always this is always a risk for respiratory failure. And the same goes for cardiac disease. So patients with heart failure have a higher chance of being severely impacted in case of infection. So therefore, we cannot stress enough the rules of, well, really common sense and basic hygiene. So using good old water and soap to wash your hands regularly and thoroughly is paramount, especially for people who are caregiving. So that was a bit like these considerations. You can read them on the website, and you can even translate them to share with your community. So then I wish to hand over the talking stick to Elizabeth, who can then provide an update on the questions from the community. Elizabeth?
Yeah, can you give me the...
Yep.
Can you hand over? Yes, Thank you. So thank you again for dialing in, logging in all, and we're really happy today to continue what we started last week, which means informing patient organizations around the world as good as possible about things to consider in the context of COVID-19 and DMD or BMD. And where we last week very much focused on prevention and also, for example, for the steroids, like is there a higher risk to catch the disease infection if we use steroids or not? This time we will also focus on what if our child gets a fever, what can be done. And so we're really happy that we have two wonderful speakers today. We will again look at are there any, what are the reliable sources, and are there certain drug supplements or vitamins that can help, and what helps, what happens with clinical trials? Well, the first one I can answer in that, as far as saying what we know at this moment. Till now, it was really uncertain that we didn't know how EMA and FDA would consider missing data, stopping trials, all these things which could happening now in COVID times. So we're very happy that they both gave out a guidance, FDA as well as EMA. We will put links on our website as well, so you can go back and check for them. And then on our website, we will have also on the news feed, we will have which companies send us information about changing their plans, their schedules in the times of COVID. So that will also be on the WDO website. And here in the slide, you see the link where to find this on our website. So then already briefly, Suzanne introduced. Today we have two experts with a very impressive track record in DMD. One is Dr. Jarod Wong, endocrinologist from Glasgow University. He has been very active also in the field of bone health and Duchenne, so we're very happy he is there. And the other expert is Professor Annamaria de Luca. I'm sure you remember that during World Duchenne Awareness Day last year, we had special information about supplements and the risk of supplements, which was also done by Professor de Luca. So then I give the microphone to Dr. Wong. So I should probably say maybe I should have said that by the experts, there is one thing we should say: experts in COVID-19 don't exist. There are DMD experts, but no COVID-19 expert, and especially not the combination of that, because we haven't seen any history now of Duchenne patient with infected with COVID-19. Okay. Dr. Wong? Are you unmuted?
Okay, so shall I, can you hear me now? Yeah. So the first question that was posed by Elizabeth is the question that may already have been addressed at last week's webinar, and is the potential effect of the use of steroids on the immune system. We know of the benefits of steroids on the muscle in Duchenne muscular dystrophy. Such high-dose steroids may have some effect on lowering the immune system, and therefore in boys with Duchenne, routinely, at least one of the reasons of it is that flu vaccination is recommended. And certainly in some countries, people taking regular long-term high-dose steroids, not just Duchenne's, have been identified as an at-risk group in the current COVID-19 pandemic by some government. Obviously, there may be some differences between different countries. I'm not aware of all the regulations. But routinely and generally, we do not see severe, unusual, and serious infections in people with DMD treated on high-dose steroids. So that's the answer for the first question. Elizabeth, can you move to the next slide?
Yeah.
Then the next question that was posed is, what is the effect of steroid treatment in DMD? and potential COVID-19 infection. As Elizabeth has already discussed, as far as we are aware, there are no boys or men with Duchenne infected with COVID-19, so we really don't have any experience. Theoretically, it is possible that if a man or a boy infected with Duchenne, the infection may be more severe, but there are many reasons, not just related to the use of high-dose steroids, because we know our boys and men have got respiratory issue, muscle issues, cardiac issue. And therefore, yes, potentially, if infected, the infection might be more severe, but I'm not sure that it's related directly just to the use of high-dose steroids and the immune system, because there are many, many factors, and hence all the hand hygiene and keeping all those things are extremely important. Next one, Elizabeth. And this question has already been discussed last week, but we thought it was useful just to stress again. And I guess some families might think, if you are saying that there might be some impact on the immune system, and should I therefore then considering stopping steroids in this current climate? And the very clear answer is no, this should not happen, as in fact is not possible. Most of you will hopefully know of the issue of adrenal suppression from the use of long-term steroids. People who take steroids, like boys with Duchenne, for a long period of time, they suppresses the adrenal glands, which normally make steroids. So we have this issue called adrenal suppression, leading to adrenal insufficiency. So generally, out of the COVID pandemic, even if we do want to stop steroids in a boy with Duchenne or any other condition, that needs to be gradually weaned over months, and sometimes even over longer period of time. Because to cope with infection, extra steroids is often needed, or the person could become very ill and be tipped into what we call an adrenal crisis. We do know that some people who are treated with long-term steroids, infection may be more severe, but one of the possibilities is that perhaps that management of steroids during these acute illnesses may not be as adequate, and that's why the response may not be as good. So the clear answer is no, not to stop steroids. Please do not stop steroids, and this is generally not possible to be done abruptly.
Okay. So the next question.
Yeah, this is next question, which I think if you've not been contacted by your clinical team, you may hear a lot more soon, and it may be there are differences between where centers are. So because of this issue of adrenal suppression leading to adrenal insufficiency, if a boy or man with Duchenne on long-term steroids has a very severe illness, particularly vomiting illness, steroids should be given in a different form. And generally, as per the most recent standards of care, the recommendation is that boys with Duchenne and men with Duchenne on steroids should have access to a different kind of steroid called hydrocortisone, which can be injected at home or in the community should they become unwell before coming to the hospital. Now, I'm aware that since 2018, different centers have been trying to roll this program. The injection is only needed in severe cases, especially with vomiting diarrhea illness, where the boy is unable to take steroid medicines. In some people, especially older people, non-ambulant men, for instance, the dose of steroid may be slightly lower and may not be sufficient to cope with moderate stress. And there may be a case to consider whether there is a need to increase oral steroids by mouth in time of acute illness, fever, or infection. Now, the majority of boys with Duchenne, certainly young boys, this is not needed. As you can imagine, that the clinical teams are now actually very stretched, and it is possible that some clinical teams may actually be asking, all boys and men with Duchenne to stick to a certain plan, so to ensure that we do not miss any boys or men. So this is something that may need to be considered. So if the boy is unwell with an acute illness with fever, there is always the question of what to do for those who are on intermittent steroids, particularly during the period on the 10 days off, or those who are on the weekend dose only. And a plan should be in place. And I think if you've not got a plan, it will be worthwhile contacting your neuromuscular teams with regards to that.
Thank you.
So this is another important consideration to just remember, because I think all of you are expert patients and you know your condition much more than the emergency treating doctor or perhaps the intensive care doctor. It is always very good to remind the treating doctor or your ambulance staff that steroids cannot be stopped. And when admitted to hospital, steroid therapy on top of all the other issues related to COVID or chest or the heart should not be the last thing you think about. In fact, it may not necessarily be the first thing that the doctor manages, but it should not be the last thing. And I recommend that those who are English speaking, let the doctors know that your son or yourself, you're on long-term steroid, you have adrenal suppression, you are steroid dependent, and in fact, you need to be treated with extra steroids when unwell. So don't make this the last thing that we all think about. And quite often, if the person is so unwell and in intensive care or in the hospital and can't take steroids by mouth, doctors should be giving those steroids by a drip. So don't make this the last thing you think about. Where can we find a lot more information? So if you do present to a hospital and the doctors are not familiar with management of adrenal suppression in Duchenne, the patient organizations, PPMD, and clinicians in the United States have developed a steroid protocol, the PJ Nikolov protocol. Almost all of you should know of that, for management of steroids during illness. This is published in a scientific journal in 2017. The link is below, which the doctor is able to access. And a patient-friendly summary is also available online on the PPMD website. And this is where we can point the people who are not familiar with the treatment protocols to the right place. But be aware that different hospitals have their own specific protocols, which works just as well already. So if they do something slightly different, don't be worried about that.
Thank you so much. And we will make the links available and easy to find for everybody who's looking for it. Thank you so much, Dr. Wong, for your explanation. And then we will ask the next expert, Professor Annamaria de Luca, pharmacologist in Bari in the south of Italy, about questions about drugs, what is done and what should we do, what can we do ourselves, or should we refrain ourselves from doing anything regarding taking drugs. So the first question is the question which is in fact asked also last week, but that question keeps coming, like, can't we do anything to boost the immune system? The floor is yours, Professor De Luca.
Hello, can you hear me? Yes.
Yes.
Okay, so this is an important point because there is a great plethora of news in the media about the potential usefulness of some specific vitamins or antioxidants or probiotics with presumed protective or boosting effect on immune system. This every day and mostly during these difficult days. So the first question is if any dietary supplements can actually help in COVID-19. The answer is no. The answer is no, because all vitamins, minerals, and other components that allow the proper function of our immune systems are in our food, in healthy food. So the main advice is to maintain an healthy diet, properly varied and with proper intake of fruits, vegetables, fish, meat, and fibers. Of course, this does not apply in cases of specific deficiency of vitamin, as in the case of deficiency in vitamin D or calcium, which do occur in Duchenne patients. In this case, of course, supplementation is very important and has to be maintained. The other point is, even if a supplement is not directly effective, can anyway be used because it's safe, is natural, and cannot harm? Again, the answer is no, because the idea that a natural compound is by definition safe is false and dangerous. Harmful effect of dietary supplements can occur by various reasons. First of all, can have unwanted action for high dosages, can have harmful interaction with other drugs used as standard of care or that need to be used in case of infection. And also, if supplements, and more importantly, if supplements are not purchased in pharmacy or in any other authorized site, such as online, they can have not proper content of principles, they can have contaminants and impurities and can have serious consequence for health. So the main point is not to use dietary supplement as auto-medication and without any control of health specialists. This applies also to melatonin, which is claimed to have a wide variety of effects, including effect as antioxidant and anti-inflammatory. This is an endogenous compound mostly useful for regulating the sleep time. And recently, there has been proposed a relationship between melatonin levels and the severity of the infection. Again, this is not supported at the moment by very strong scientific evidences, and the use of melatonin, especially if not under control of doctors, has to be really not encouraged at all. Thank you.
Thank you. Shall we go to the next question?
Yes, please.
So the next question is, we also have heard a little bit last time that there might also be an aspect on the steroids that probably could have a positive effect in COVID-19. Could you explain a little bit more about that?
Yes, in fact, there was, it has been proposed that low dosage of steroids can be useful in the so-called cytokine storm. Cytokine storm is a severe phenomenon that may occur in COVID-19 patients at advanced stage of pneumonia. Normally, the activity of our immune system is very important to contrast the infection. However, at a certain stage of the disease and in some patients, there could be an excessive discharge of virus from the infected cells, leading to a marked production of cytokines. And this reaction has to be controlled because it's very, very serious. So among drugs that can have interest against the cytokine storm, there are steroids. In China, especially, it has been proposed that low doses of glucocorticoids, such as alpha-methylprednisolone, can help to reduce the storm without causing a massive immunosuppression. And at the moment, some clinical trials are ongoing in COVID-19 patients, but I have to say that there is some debate about the usefulness of steroids in this context. By the way, in this frame, I think this is another reason not to stop steroids in patients. Of course, it has to be proved that the low steroids doses are really interesting and important for the cytokine storm and what happened to patients that are already under chronic treatment with steroids. But for considering the information we have right now and all the data and the information that Dr. Wong provided, it is important not to stop the steroid treatment unless specifically indicated. And this is valid also for other standard of care in patients. Also, the treatment with ACE inhibitors has been questioned, but there is no scientific evidence that this therapy can be actually not useful, can lead to worsen the infection by the virus. And actually it is not proved, so it's better to maintain drugs that are effective in controlling cardiovascular function in Duchenne patients. Thank you.
Okay.
And
do you want me to ask the next question?
Yes, please.
And there has been some discussions also on fora about what is the best drug to treat fever in the case of COVID-19. Could you have some information about that?
Yes, indeed. There have been many reports about the preferential use of paracetamol rather than other non-steroids and anti-inflammatory drugs, with the idea that these latters can actually have a too extensive anti-inflammatory action that could be not useful in case of virus infection. By the way, this has not been confirmed, and recently the European Medicinal Agency actually said that patients with COVID-19 can use any anti-inflammatory drugs according to what the doctor decide in relation to patients and to the drug and the risk-benefit ratio. Say that the specific situation for Duchenne or Becker patients can be different, consider that many non-steroidal anti-inflammatory drugs are not advised because of the concomitant use of steroids. So in these settings, paracetamol is for sure the first choice drug. And importantly, it has to be used for at low dosage and for the shortest time possible, because I would like to underline that fever is also a symptoms important to have a diagnosis of for the COVID-19. So it's important to understand if fever is there, because helps doctors to make a proper diagnosis. I'm ready for the next questions.
Yeah, it's coming. This is one who is, we saw like half an hour ago, the Trump tweeted something about this drug.
Yes,
really
this is a very hot topic. Yes, the chloroquine useful for treating the infection. It's important to say that at the moment there is no approved therapy for COVID-19. We unfortunately, and there is a lot of efforts in searching for effective drugs. And it's also a very dynamic field because we try to learn from what we live every day. So it happens often that we have a lot of impressive news, and we have to understand the balance between hope and reality. So for chloroquine, this is very interesting because chloroquine is an old drug. It's used as anti-malarial drug since many years, along with its metabolite, hydroxychloroquine. There are evidences that this compound can reduce virus entry in the cells. And in this case, could be somehow interesting to assess its use as prophylactic drugs in infected, and also in usefulness in infected people. Studies are ongoing, so there is no clear proof that chloroquine can be actually effective. But what we have to learn in this case and to think about is that the chloroquine, even if it's safe, is not totally safe. It may have important side effects, especially at heart level, because it can lead to prolongation of QT intervals in the heart, and these can lead to dangerous arrhythmias. We know that many Duchenne patients may have prolongation of the QT intervals, and this unwanted effect can actually be more important in association with other drugs. So it's fundamental to remember that the chloroquine and hydroxychloroquine have to be used under strict medical control and monitoring very carefully heart function. And of course, again, any possibility to get drug from non-authorized source on internet and self-medication is absolutely discouraged because can be seriously dangerous.
Thank you so much. I think this is really what we all needed to hear. Thank you so much. And then the last question to you, at least at this moment, is, but what are the drugs which are currently used when a subject is infected with COVID-19?
As I was saying, this new coronavirus is a new virus. Therefore, no specific drugs are available. However, during the last decades, a lot of progresses have been made in the field of antiviral drugs. And we now have drugs effective against the virus for HIV infection, hepatitis, and SARS, Ebola. So those viruses are somehow similar to coronavirus in that they are all RNA viruses. And so even if they are different, what is hoped is that some basic mechanism between the viruses is maintained, and so a drug developed for another virus can help in case of infection by COVID-19. So in this general frame, some drugs used for HIV infection or Ebola are used off-labels in infected patients. And off-labels, as you know very well, means that there is no specific drug against the main cause of the disease, but they can help for the mechanism of action. So I can mention a few examples of drugs that gave promising results in China and in Italy, and you probably heard in the media. One is remdesivir, that is a nucleoside analog that has been developed with some controversial results for Ebola, and it seems promising for patients affected by the new coronavirus. Some clinical trials are ongoing in China. Another treatment is with the combination of interferon alpha with inhibitors of viral proteases, such as lopinavir and ritonavir. This is a classical cocktail used for HIV infection and is also possible in children older than 2 years. Other classical antiviral drugs, such as ribavirin with other inhibitors of reverse transcriptase, used again for HIV infection, have been considered with different level of enthusiasm. And another promising drug is favipiravir. This is an antiviral drug used for infection by influenza virus. Is available in Japan, and some use is ongoing off-label and with clinical trials for having a better idea of efficacy. Similarly, some antibacterial drugs, and this has been mentioned also for chloroquine in association with azithromycin, can be used according to the general state of the patients, and considering that some opportunistic infection, bacterial infection, can also occur. I would mention also tocilizumab. Tocilizumab is an inhibitor of interleukin-6, approved for rheumatoid arthritis, and with a great potential to control cytokine storm. This has been used with success in Italy on few patients, and the clinical trial is ongoing now. Of course, all these drugs are drugs that need to be prescribed and have to be used under medical control and many of them have to be used only in hospital settings. So these are not drugs for automedication. Again, automedication is really dangerous in these conditions, especially in patients that already have a complex standard of care, like Duchenne patients. So another point is that intensive work is ongoing to try to obtain a vaccine, as you probably heard, worldwide. And there is also the attempt to use plasma extract of patients to try to obtain compounds that can be helpful for infected patients. So for the moment, this is the situation. Again, it's a very dynamic situation and things change rapidly day after day because it's really unclear which is the best strategy. So we have to rely on daily experience and scientific basis.
Thank you. Thank you, really. Thank you so much. And while listening to both of you, I realize how fortunate we are in the Duchenne field to have people like you, not only with the knowledge you have, but also that you're willing on Saturday afternoon to show up for us and help us to respond to all the questions the families at home have. And really, thank you so much. Probably you've seen that some questions came in merely for Dr. Wong. The first is, if someone is supposed to start steroids now or soon, does it make sense to wait until the pandemic is over? Can you unmute Dr. Wong, Suzia?
I'm not sure that there is, so I suppose thing to say is that I'm a pediatric endocrinologist, and this is sort of like a neuromuscular sort of decision. I'm not entirely sure that there is actually a potential benefit or disadvantage, but I suppose in the current climate, we also need to consider what's practical. I certainly know in the UK, the GPs and pharmacists are completely overwhelmed, and new prescriptions are either very slow or not being attended to. So I'm not sure that there is a particular sense to either delay or start straight away, but it may just be determined by what's actually possible in this current climate.
Thank you so much. And there was another question which I think Duchenne families all have and suffer from, and that is that it's so difficult to have clinicians listen to you. If you end up in a hospital in a crisis and families have information or want to point out on something, it's really very hard to get the attention you need for your problem. So somebody asked here, would there be a possibility to have a phone number of an expert? So the doctor could call the expert and hear from them what needs to be done?
So I guess it really depends on the system in your hospital, or indeed in the country, addressing specifically just on the steroid management. Certainly in my hospital and in a lot of UK-based hospitals, there can be alerts that can be put up that other non-Duchenne related doctors can view, but of course sometimes they still don't view it. Some of us will over the week quite soon be sending out specific instructions and letters for the patients with regards to steroid management plans and what's needed. So I guess that can be shown to families. I am aware that different patient organizations have different apps and alerts that I suppose can be used. And I guess you just need to clarify with your neuromuscular team, is there a specific contact person that they can mention, that they encourage or ask the emergency treating doctors to contact. So I guess that's just generally the advice, and it may just differ depending on the setup in your hospital or your country.
Thank you so much. Thank you. So then this is kind of the end of the part with the questions to the experts, and then we will a little bit like last week say what what you as patient organizations who are online now can do to change the situation in your country or help support. And one of the things is that as patient organization, as a Duchenne patient organization, we are in a fantastic position to tell everybody and use all our tools and social media and maybe emails to donors, to volunteers, to tell them stay at home and do it for us. For our children, it's extremely important that you stay at home and help us to slow down the spread of the disease. So I would recommend everybody to start a campaign. We could use the hashtag home for Duchenne, because it's really very, and Becker as well, of course, because it's really important that we slow down the progression of the disease. And we have the best story. There are not many people who have such good stories as we have to tell why it's so important. Strictly adhere to national and local authorities and guidelines. Avoid the spread of fake news in your community. If you doubt about some news, come back to us, and like now, we will find the experts who can explain to you what is real news and what is fake news. Share this webinar and the report. We will make a report again with the main topics from this webinar. Spread the best information you can. Follow the next webinar. Nicoletta will announce that later. If you have questions or you hear relevant questions, please send them to us. So that helps us to prepare the next webinar, which will be next week. And what can we do for you? Well, it is that we recorded again this webinar. We will again make a report, translate. You can go to our website and look at the live feed where you see the news. We update that, as we said earlier, also about what clinical trials, what is changing in the field of clinical trials or might happen there. We will have the weekly webinar, and we really would like to support everyone where we can. So don't hesitate to contact us. Then now I'm leaving you, and Nicoletta is the next to speak to you.
Hello, everyone. So we are all happy to have you here online even today. And it's nice to have this weekly call all together on this emergency, because now we are all on this together and we can move forward only together. I just wanted to show with you two nice pictures that arrived this week with the Home for Duchenne and Home for Becker hashtag, because as Elizabeth told you, it's really, really important to continue sharing photographs of your sons and of you at home with this hashtag, because it's important to raise the awareness of of the importance about staying at home, especially for people with severe diseases like Duchenne, but for everyone, because the impact of one person can be really, really important for the community. So here we have three fantastic children showing how they are living the quarantine time, and they come from different places, from Spain and from United States, and it's really, really important that this campaign will move forward, and we need your help and your support in your countries. From our side, as Elizabeth told you, we are always here to help you, to listen to your needs and your question, and continuing about information and supporting your groups. So we really thank you for being here today, and we wait for you for the next webinar next week.
Okay, so I think that's it. Thank you all so much for joining this webinar. I'm sure we have touched a lot of questions, but not all of them. So if you have any questions that are not discussed that you would like to have more information for, just contact either Nicoletta or me at the email address as shown here in the bottom. We will share the recording of the webinar soon. We will upload it, and we will make sure that you will receive the report so you can further disseminate the learnings we had during this webinar. So thank you very much for tuning in. I'm giving you back 15 minutes of your time, and I wish you all a very happy weekend. So thank you all, and speak to you soon. Goodbye.